I might actually get you to think more about doing it twice a week as opposed to just once a week. Now let's have a look at the next line. The second option is the slower option and is best suited for patients who don't have anything urgent coming up and are independent with some exercise history to do rehab on their own. Now again, I qualify this by saying that it's the slower option. So this is to make sure they understand why it's only once a week. And then I also tell them that this is better for people with independent exercise history and they have the confidence to do things on their own. Now, the reason why this works is if you are someone who is unsure about coming twice a week, but you also have zero exercise history, can you see how by sharing this information, I might actually get you to think more about doing it twice a week as opposed to just once a week? Next, I give the timeline again, which is once a week until we clear you for discharge. Then I go through the pro-con again, which is the benefit. If you have the experience in rehab, then all you need is weekly guidance and progression for which you'll improve. But the downside is if you don't have the experience or you don't have the confidence, then this can actually be too little attention and some patients end up getting worse. Here's why it might work. But if you don't have that, then it could actually be the worst plan for you. Now, when you deliver the con of this segment, it has to be true because if you have something like a tendon tear, if it's managed poorly, it will get worse. It will retract, you might need surgery, and this could all be prevented if we just treated it properly in the first 4 to 6 weeks. Now, this is the important part. I also include the risk over here, okay? And this should be clinically justified because the truth is, if we don't give people the clinical justification of why they should do a better plan, then it's really not going to hold any weight and they're not going to buy into it conclusively. The second reason why you should educate them on the risk is it's just better for them. Like, we don't want people to do a treatment that isn't going to give them the outcomes, especially if the outcome is irreversible. And the last reason why this works is because most people are risk averse. And when you tell them genuinely these are the risks involved, they want to avoid that and they might actually pick something that's a little bit more urgent or a little bit more premium to make sure they get a better outcome.